So when you speak of smoking, the second-hand smokers, that a person who is standing beside a person who is smoking are high risk compared to the person who is smoking. So always see that you stay away from that person or wear a mask when you are nearby. Second cause is obesity. Because of the obesity, colorectal cancer as well as breast cancer may occur in females, or colorectal may occur both in male and female. And then dietary, especially if your habits like you eat a lot of junk food, or there are a lot of chemicals in the food substances what you eat, the grocery what you get which are not fresh, or it is a tin food, packed food also may contain a lot of chemicals, and that interferes with the cell distribution, and that may also cause a predisposing factor. Another form of skin cancer because of ultraviolet rays. Usually they say that you should not go out on the sun at the times like after 11 a.m. to like 2 or 3 o'clock. And even though if you're working outside in the sun, see that you wear a full sleeves cloth, wear the sunscreen lotion on the face, on the skin, and that will prevent the radiation going directly into your skin. So, non-modifiable risk factors, especially the age, some of them may be above 65 years, and especially people who having cancer in the families or genetic it's called, they are high risk of getting these cancers. Let's talk about early signs of cancer, which you have to be taken care of by doing a regular physical examination or body checkup, and go to a physician or a gynecologist, especially for females. So early signs may be persistent fatigue or feel tiredness. You cannot do any of the activities. If you're working, you cannot do it. If you're at home, you cannot do your house chores. Or changes in skin. If you have an existing mole that increases in size, or you have a lymph gland enlargement in any part of the body which doesn't come down within few days, that may be an early sign. And also changes in bowel and bladder pattern. We have constipation and diarrhea alternatively, and then it occurs for a few days, and your pattern of the bowel and bladder changes. And especially for females, if you are in a menopause or perimenopause, you may have increased bleeding, non-stoppable or scanty bleeding away from your menstrual cycle, especially for perimenopause. That may also be a sign. And there is STD, sexually transmitted diseases, that may also cause increased secretions, and then you need to go to a gynecologist to check for that. So what are the tests to be done? Let's discuss about that. Let's talk